there is a massive shortage of low vision specialists. So in focusing on our patients' optical needs, are there any tools or tips that you have for prescribing optometrists to try to help provide patients with the best care that they can when there's an absence of a low vision referral that they can make?
Yeah, so there's a few things. First thing is, one, make sure any other ocular diseases are managed appropriately. The last thing you want a geographic atrophy patient to go through is some form of glaucomatous damage, because if they do, then now they're starting to lose peripheral vision. So if they've lost a certain amount of central vision, we want to preserve everything they have. The second thing is make sure there's no signs of any type of underlying ocular surface disease, because that can compromise things in a healthy patient, let alone the individual that's already compromised. And a third thing is pay particularly close attention to cataracts, where you may not necessarily warrant a cataract referral for an individual who's 20/25 or 20/30 with a healthy macula. Those individuals who have some form of compromise may actually benefit as a percentage of visual improvement more so than the individual with AMD, because again, they're looking for any type of advantage with their vision that they possibly can get. So now we start talking about the things that we can actually do. Well, we talked about ocular surface and glaucoma management, making sure that we're doing those. But certainly optically, we need to make sure of a few things. One, they're optimized in every single lighting situation. So be cognizant of the fact that if they require prescription, they need to make sure that they have appropriate outdoor prescription, so sunwear, and whatever they're using inside. The other thing too is a lot of times these individuals may benefit from multiple pairs of glasses. I learned this from my senior partner with the presbyope. It's very rare that one pair of glasses can suffice or meet all of your visual needs. Looking at a heavy computer user versus glasses that you use for everything else, you can't use a pair of progressives effectively unless you want a high chiropractic bill. You can't use a pair of progressives on the computer all day without having some form of strain. So you have a second set of glasses that are specifically built for the computer screen that's going to help you focus and feel better towards the end of the day, especially if you're on the computer screen all day. Well, would that same patient with some level of low vision needs benefit from something that's prescription that's just for up close? The answer to that is yes. One of the other things I would share with you, Jen, is sometimes these patients are getting treated and they're not end-stage GA patients. They still have good functional vision. One of the things that we've started to look at much more closely is binocular posture, in particular vertical binocular posture. These people sometimes come in with the wildest complaints. Cues to say, yeah, I do think I need to do more binocular testing is if you do your binocular balance and you remove the binocular balance and you ask the patient, do you see one row of letters? And they say, nope, I still see two. That may be your cue to start doing just a simple von Graaff euphoria in the distance for both vertical and horizontal posture as well too.